So happy Tuesday. Had to remember what day it was. Happy Tuesday, everyone. Welcome to the WRLC West Region Learning Community. My name is Zami Tinashe Hemingway. My pronouns are Zami, he, and him, and I'm the Capacity Building Assistance Learning and Development Manager with Denver Prevention Training Center. We're so happy that you all are joining us today for our last WRLC of the grant cycle. And so before we really get into it, on the behalf of Denver Prevention Training Center, California Prevention Training Center, and San Francisco Department of Public Health, Get SIBA SF, we want to say thank you to all of you for 3 amazing years of monthly learning community. Throughout the past 3 years, we really were able to learn and grow together. We had some amazing presenters, some amazing feedback from you all as attendees. And we are truly grateful for all of you who show up every single month or had representatives to show up every single month for the past 3 years. So give yourselves a round of applause. And thank you to the other West Region SIBA providers for being such amazing collaborators and partners. Okay, so with that said, we are going to go ahead and jump into our presentation. I'm just going to hand it over to Lisa Frederick to introduce herself. I feel like she's a woman who does not need an introduction, but I'm going to go ahead and give it over to the fantastic Lisa Frederick, who's going to lead us today. And before we get started, everyone grab your pens, papers, notepads, anything to take notes, because I'm always wild whenever I get to sit and witness a presentation by her. So
All right, Zami, Zami. You are definitely Zami. You're setting me up. Your words are too kind, Zami. Thank you, and thank you everyone for coming. This is definitely a topic that is near and dear to me. For those who do not know me, my name is Lisa Frederick, and I am so happy to be part of the Denver Prevention Training Team. And I've been a consultant with Denver for I think 3 years, maybe almost 4 years now. Besides that, in my other life, I am co-founder of Black Women's Learning Institute, and we are a national center that's focused on the health and wellness needs of Black women. And we are very intentional to look at Black women across the lifespan. So myself and my other co-founder, Dr. Hannah Tessima, we are truly committed to improving health outcomes for Black women through culturally responsive programming. We aim to provide safe spaces for critical conversations that provide a deep understanding of the history and of the current issues that impact the health and lives of Black women. We also are intentional about trying to create pathways for Black women to inform their clinical providers about what they need to achieve optimal health. So I'm going to start sharing my screen so we can get it going. Again, Zami, thank you for the opportunity, for tapping me to do this. Thank you you always have such kind words. I surely appreciate all of your engagement around what I do. So I really do think that. As far as like the rest of the Denver team, I thank everyone for always embracing other things that I do. So we just want to get, although I see so many of my wonderful team members and bosses in the audience, just want to also in chat, just put your name, what you do, your affiliation, and let Zami and I know if you are familiar with weathering. Let us know if you're familiar with weathering. I just said yes. And if you are, I'm interested to know, when did you start hearing about this issue? So put that in chat. Let us know who's in the room. If you're familiar with weathering, and if so, is this something new, or when did you start hearing about weathering? I kind of want to get a sense of people's relationship with weathering. Yeah, I see things coming in. Yeah, so right. So Katie, thank you for coming, Katie. Katie, you said you became familiar with because we do this in the trauma response course about a year ago on Che, concerned about whether and during the presentation. Yes, at last year's USCHA. Zami, about a year ago, Zami, of course, is Denver PTC. Julia, probably the last several years. Hi, Azul. Azul, a couple of years ago. A long time ago in grad school. Carly, okay. Dr. Mariska Osborne Wells, thank you for coming. About 2 years ago. Jane Ward. A lot of people like the presentation because we did a presentation, a weather presentation at USCHA. So I asked that because until recently, there has been little discussion about the insidious effects of social justice on the body. And this is not new news, but we're just hearing and talking about this. And these are from health professionals that are really like, well grounded in our field of public health. So hopefully weathering shifts the paradigm and shine a light on the topic and hopefully offering a roadmap for hope. So that's like some people put in the chat that they first heard about it during the presentation that we did at USCHA. And so myself and Hannah created a video showing how weathering unfortunately occurs throughout the life of a Black woman. So we do want to show that now. We premiered it at USCHA. So I want to share that video with you. And I do want to get kind of some reaction, a little conversation after the fact. So let's see the video.
Women in America deserves our undivided attention. Meet young Michaela. Like all girls her age, she grows up searching for a sense of self and personal identity, exploring her personal values, beliefs, and goals. Michaela begins adolescence at the intersection of racism and sexism, becoming familiar with the dynamics of power and privilege. She begins to develop her sexual and occupational identity amid multiple levels of racism: personal, interpersonal, institutional, and structural. She must contend with the beliefs and prejudices that are expressed about her and is subjected to discriminatory policies and institutional practices that do not consider her best interests. According to a national survey by the Georgetown Law Center on Poverty titled Girlhood Interrupted: The Erasure of Black Girls' Childhood, the 325 mainly white adults surveyed felt that compared to white girls, Black girls need less nurturing, need less protection, need to be supported less, need to be comforted less, are more independent, know more about adult topics, and know more about sex. Unlike her white peers, she does not get the support and protection children need to feel safe and valued. Systemic racism pushes her into social, emotional, and physical adult roles before she's ready. This kind of chronic stress and racism weathers or wears away at the body, accelerating aging and disease.
As Michaela reaches womanhood, she begins to form intimate relationships, seeking autonomy, independence, and emotional stability. Unfortunately, Michaela is more likely to report a higher number of adverse childhood experiences than her white counterparts. By now, she is more likely to experience health disparities and have worse health outcomes than her white peers when it comes to diabetes, heart disease, breast cancer, cervical cancer, mental health, HIV, and more. As she looks toward motherhood, she must deal with the reality that she is more likely to die due to preventable pregnancy-related complications at a rate 3 times higher than her white peers. Michaela grows older, adjusting to retirement, physiological changes, and the possible loss of parents and spouse. Her lifelong stressors, such as repressing justified anger to avoid being labeled an angry Black woman and experiencing systemic racism, have long-term consequences. Her allostatic load, the cumulative effect that chronic stress has on mental and physical health, is far higher than her white peers. How can we change the trajectory for Michaela?
I'm going to stop sharing for a moment. So before I kind of ask your thoughts about the video, I do want to tell a little bit like more about the study that we talked about, the girlhood, the racial Black girls' childhood. So this report and its underlying findings represent a key step in addressing disparate treatment for Black girls in public systems. But what was really, what I found so interesting about this report is that the report builds on similar results that have emerged from studies of adult perceptions of Black boys. So in 2014, for example, there was a researcher by the name of Professor Philip Goff, and his colleagues revealed that beginning at the age of 10, Black boys are more likely than white peers to be misperceived as older, viewed as guilty of suspected crimes, and face police violence if accused of a crime. But this is even so much more important. In this study, we had seasoned police officers that they sampled in the study that consistently overestimated the age of Black adolescent felony suspects by approximately 4.5 years. So that was like really telling. In addition, those officers assigned greater culpability to Black male felony suspects than white felony suspects, whom they estimated as younger than their actual age. So this kind of adultification, yes, it affects Black women, Black girls by all means, but it was also because of a study on Black boys. So that was really interesting. So the adultification starting early, when we're talking about weathering, starting early for Black people, young boys and girls, is really such as a topic that needs to be delved in much and talked about much more. But on the video of Michaela, just want to get, some reactions. What stood out to you in this video? What questions do you have about the video? But what really stood out to you about when watching Michaela? What stood out to you? What stood out to you as Michaela aged and how she went through from childhood to adolescence to adulthood to an older age? Just what spoke to you in the video?
She never got any sort of relief. It was just stress that kept building and building. There was no undoing the stressors that started in childhood. And as somebody who has the same name and shared a lot of life experiences, it was difficult to watch. It was like looking in a weird mirror.
Yeah, that is the point of it throughout Michaela's lifespan, that she didn't get any relief from the stress, and maybe not every part of her life was as stressful as the one before, but this was a constant stress from different aspects and different avenues through her entire life. I see Terry said compounded stresses appear to weigh heavier and heavier. Anyone else?
In the chat, Katie also put compounding life stress and how it affects her well-being, happiness, and health outcomes throughout her life. And then Sophia put her health outcomes had nothing to do with anything she did or didn't do, speaking to the blaming people receive from mainstream rhetoric.
Yeah. That is also really important, because the stresses didn't have anything to do with what she did or didn't do. It was just her existence and her going through her life. Any other comments on that video? All right, I'm going to reshare my screen. All right, share that. All right. Okay, so what the video really does is sets a tone for the rest of the talk. And the video also kind of sets us up because we're going to expound on some of these topics and issues throughout the presentation. So the objectives of this presentation, I'll discuss the impact of racism on the body and how that leads to biological weathering and premature aging. We want to discuss the connection between chronic stress and HIV acquisition, pathogenesis, and treatment. We have some information on that, and explain the impact of biological weathering on Black maternal health. All right. So I do want to kind of look at the background, because a lot of times when you hear about weathering, the background is really interesting. So this weather hypothesis dates back to 1992. And so when I asked that question, many people were just really kind of heard or kind of discussing weathering or issues around weathering just recently. So dates back to 1992 when Arlene T. Geronimus proposed it after learning that young Black women had better pregnancy outcomes in their late teens than in their mid-20s. So by contrast, she found white women face the lowest risk of pregnancy complications in their mid-20s and highest risk in their teens. So weathering was a concept that suggested itself to Geronimus early in her career when she began working with pregnant teens and teenage moms in the community. I don't know how many people are familiar with Trenton, New Jersey. Trenton, New Jersey is a predominantly Black neighborhood. And she started working and doing research with young teens and teen moms in Trenton. So there was certainly a whole narrative that teen motherhood somehow caused perpetual poverty, lack of education, and poor health outcomes. And Geronimus said she did a 2018 interview, and she was saying, well, let the data speak for themselves. That the risks were higher in Black women the later they waited to have children, and that was not true of white women. So this is just some more background. So this is really interesting, and I didn't know this until I started doing more research. So when she's talking to these young Black women doing her research, she said, well, what I was supposed to do was to help teach these young Black women who allegedly didn't know anything about contraception. But what she found out was that these teenage Black moms who had knowingly made, seriously, a calculation that flew in the face of popular conceptions about them. So these young moms, her research suggested, had surmised that it was safer for them and their children to get pregnant early because they expected from the experience of older Black women around them to develop chronic illnesses and have shorter lifespans. This is so interesting. They looked at older Black women around them, and they saw this chronic illness and these shorter lifespans due to all of these things that we're going to talk about. And they calculated that they're going to have children earlier as per Geronimus' research. So that's when she came to the conclusion that these young women had experienced less stress from racism in fewer years, resulting in the birth of healthier children. So this is the whole concept of how weathering actually began. But what was expected was that Arlene Geronimus faced significant pushback for the weathering hypothesis from the medical community. She faced pushback from economists. She faced pushback from sociologists whose research had attributed racial differences in health outcomes to different genetics, to culture, and to life choices. So this was a cast iron assumption at the time of public health and political conventional wisdom, was that teen pregnancy was damaging, a health risk to mothers and their babies, and also the result of ignorance. So she found that not only were Black teen moms not at higher risk, they were actually at lower risk because they had experienced less stress due to racism in their life. And during this time, she said, no one believed me. It didn't seem like common sense to anybody what she was saying. So she faced so much fierce resistance. And that's one of the reasons why she said she wrote her book. So during that time, this was like in the 90s, there were so many headlines in papers and in books and magazines, really talking about how damaging her research is, these findings were. So she said in one newspaper, one of the headlines said, "Research Queen says, let them have babies." And she said that these weren't like right-wing papers, these were popular press. And she actually received death threats. She said she had no constituency. But she also said that the opposition, she found that it was also racial. She recalls an article in a paper, and the headline said, "The slave masters must be dancing in their graves because they have all in Geronimus keeping Black teenagers barefoot and pregnant." She was called the biggest threat to youth in the country because everyone had been led to believe that teenage motherhood was a sign of degeneracy. It didn't really have any support. And this was despite the fact that her work on teen pregnancy was solid, was credible, was peer-reviewed, and it was published in top journals. It just happened that what she was saying was deeply unpopular when she brought in this issue of weathering due to racism. So with that, I want to pause for reaction. What are your thoughts? Or just give me something like, had you heard this before? Because every time I have heard of weathering or go to president, I never, kind of hear this background, of what happened up to that point. And even though it was peer reviewed, but it was not well accepted. Because like I said before, these differences in racial differences in health outcomes historically were due to different genetics, cultures, and life choices. But Dr. Geronimus threw something else in there from her research. So any reactions? Can't, where's my... Any reactions to that? And does anyone remember this article? I don't want to age people because this article was a couple years ago.
Hey, Lisa. I
Yes.
don't remember the article, so you're not aging me. But one of the things that is sitting with me around what you just shared is the level of distraction people try to use instead of actually really processing the information that she provided. Because the research is because of racism, as Black women age, they're more likely to have issues with pregnancy because of systemic racism, societal racism, and that the issue is we need to address racism. Instead of them actually focusing on the issue of racism, they use teen pregnancy as a distraction to discredit her instead of actually being held accountable for the societal issue of racism. So that's what's really sitting with me, is how the way that people are able to use something else as a distraction from the real issue just to avoid accountability or actually addressing the real issue.
Yeah, thanks, Ami.
In the
What we got
chat,
in the chat?
Sophia said gaslighting in the chat.
Yeah. Yeah, I thought that was pretty horrifying, especially the headlines and how no one brought into this, no one from, and although the research spoke clearly, but even economists, no one brought into that because they were, very fixated on what they thought it was. All right. So let's look at what is this weathering? So I love this slide, and we use this in our CAM Academy trauma responsive care. So weathering is a chronic stress-related biological process that leaves marginalized or exploited Americans vulnerable to dying or suffering from chronic disease and disability long before they are chronologically old. It afflicts human bodies all the way down to the cellular level as they grow, develop, and age in a racist, classist, xenophobic, and homophobic society, fortunately. It wears down the body's systems and body's organs. So you kind of have like a body-wide health vulnerability. Your biological aging is accelerated, and you're more prone to many different diseases and conditions and early death and or disability. So through weathering, Black women age young. So human bodies are adapted for short bouts of fight or flight in the face of acute life or death threats. Weathering literally tears down your heart, your arteries, all your body systems, so that in effect you become chronologically old at a young age. And as we see now, weathering is the subject of hundreds of peer-reviewed studies, thousands of citations. The weathering hypothesis is now widely taught in public health schools and accepted as perhaps one of the most plausible scientific explanations of how American society grinds down Black and brown bodies. And the weathering paradox that relatively young people can be biologically old. And hopefully this influences policy decisions at all levels of governance. This is our hope. So, and Katie knows, because Katie and I have trained this together. It's a slide that we use in trauma responsive care. We use a slide for CAM, the Center for Addiction Medicine, otherwise known as CAM, was actually established at Denver Health in 2018 to provide trauma-informed treatment of substance use disorders by providing education and technical assistance. And every time we do this, we ask, what does this image kind of say to you? How image-wise does this kind of give you a definition of weathering? And every single time that I've done that training, which is, I've done it maybe 12, 14 times, I hear some new stuff on what people see in this image. So I would love to extend that to this audience. I think this is a really good image that really depicts weathering. So we'd like to hear, we have trainers in the room. You know how we do. We want to hear some voices. Trainers in the room, come on, help me out here. We want to hear some voices. When you look at this slide, what stands out? This slide is a really good kind of definition, a visual definition of weathering. What stands out?
Hey Lisa, it's Mariska. Now, I can just say I've seen this a couple times, and every time I've looked at it, I see something different. And this last time I had looked at it, there's flowers growing over the non-melanated person. And then when you look further over the person of color, it's just dirt that's washing away.
Yes. And Mariska, I have seen this slide like 10,000 times before I even noticed that. Every time I see this, like you, I see something different. Hi, Anshay. Thanks, Mariska.
Hey, no, I'm appreciating this conversation. I immediately begin to think more about the alignment of weathering with like adverse childhood experiences, what that looks like, and how some of this often may play into some of the experiences that adolescents may experience. But in looking at this image, I think I align. I mean, I share very similar sentiments as what was shared before. Just thinking about like various like waves that are coming through and just like washing us away, and it just like sucks that this always happens. And I love this image of this person trying to hold someone back from the wave, but in the midst of it, still putting themselves in danger in it. And so it's just a lot of work that we have to do, and even just not only trying to save ourselves, but save those that look like us. And it's just a lot. Yeah.
Yeah, this is a lot. I love this image. And I remember someone else said, like, when you look to the left, the less melanated person is just, their back is just like, it's not even affecting that less melanated person. Their back is turned, and they're not feeling any of the effects of the racism, the bias, alienation, the structural inequality. So many things kind of stand out here, but this is like a really good image. And Mariska, like you, every time I see this something else, I see that I didn't see before, like the flowers growing over the less melanated person, and also, oh, hey, Mariska.
Oh, finish your thought, Lisa. I just had one more thing.
Oh, no. So also what someone else said is that, and they brought in a whole aspect of colorism, how the melanated person who's darker, the darkest melanated person, is facing more of the brunt of these waves. Hey, Mariska.
So I was going to say, in the waves, one of the things that I noticed was a lack of culturally appropriate services. And I think as people of color, we go through society knowing that we may not ever find culturally appropriate services. So we have this ability to adapt and acclimate that I don't think a lot of people realize that when we say, you know what, I don't see dermatologists that look like me. But I was very surprised when I went to Atlanta, there's actually a practice of Black providers. So coming back to Colorado, it's a rude awakening that I have become so adapted that I forgot that there are people that look like me in the service industries of healthcare that I need. And I just need to start seeking them out. And maybe that medical tourism has become part of our lifestyle and we didn't know it.
Yes, yes. Thank you for that. Thank you for that. That is super important. Thank you, Dr. Mariska. Hey, Zami.
Hey Lisa, I also just want to add, I don't know if this looks like it to other people, but in the wave it looks like there's a baby to me. Um and that the baby's like being swept away by the racism and bias. And it almost looks like the darker person or the more melanated person, like they don't have hands to even be able to hold on to the baby. So almost as though they're like, I'm just like almost helpless. And when I saw this, one of the things I thought about was how a lot of the deaths that I hear about or the complications I hear about around pregnancy and Black women, it tends to do with, the black woman saying, hey, there's an issue, there's a problem, there's pain, something's up, and folks aren't listening to them. And so they're almost like helpless in this process, and then they end up losing their child, right? And so to me, that almost represents the experience in the medical room as well, when trying to give birth or trying to advocate for your needs, and how you're just, because of racism and bias, you're not actually believed.
Wow. Thank you, Zami. And yeah, I saw that too. It does look like that's a baby there. But I think this is just such a really good kind of visual definition. And it's just, you see so much. There's so much to see here. Zami, anything else in the chat?
No, the chat is clear.
Okay. All right. Thank you for that. So just like another kind of, you know, if analogy for lack of better words, like when we hear the word weathering, you may think of soil or rock erosion, happening beside a stream of water, or paint on the side of a house fading under the sun. In this case, we're talking about weathering. We are talking about weathering and its effects on Black bodies. So then also what what got introduced in the video is the allostatic load. So allostatic load is a physiological burden of constant adaptation to stresses. And this is one way of measuring weathering. So allostatic load refers to the wear and tear on the body due to repeated activation of the stress response, and thus may be an early subclinical indicator of future disease or mortality risk. So, and we definitely have enough research to say without doubt that it is found that experienced racial discrimination repeatedly can create a state of biological imbalance that leaves certain groups of people more susceptible to chronic disease. These numerous studies show that Black women have higher levels of allostatic loads. So a collection of biological factors like high blood pressure, high blood sugar, that collectively raise an individual's risk of developing chronic illness. So Black women are more likely than other racial and gender groups to experience chronic disease, including heart disease, stroke, diabetes, and cancer. And it's worth mentioning, I just did a menopause presentation the other day, and what happens as women age, but because how weathering affects Black women, when after, uh, postmenopausal, menopausal, women lose a lot of protective factors that kind of, protect you because you're losing all this estrogen. And that's a protective factor of heart disease and all these other things. So that even raises the level of risk for Black women as we age, because we lose additional protective factors because we're losing all this estrogen. And research indicates that there is a correlation at that last bullet between chronic stress and adherence to HIV treatment, as well as relationship between stress levels and decreased CD4 counts and decreased viral loads, which definitely can contribute to HIV progression. So when you look at all this research, the very real idea that racism is a major contributor to chronic health conditions runs counter to narratives that cite racial biological differences like lifestyle choices, socioeconomic status as the culprits. But indeed, these studies that point to racism control for all those things and still come to the same conclusion. So high levels of stress hormone can be toxic for Black women's bodies, especially if the women are repeatedly pushed into a fight or flight state, and they're pushed to this state by prejudice, being marginalized, institutional bias, and oppressions. So I'm thinking, like, with this slide, I wanted to introduce the USCF. There's a USCF Bixie Center of Global Reproductive Health. That's a center at USSF. And they integrate research, training, clinical care, and advocacy to advance reproductive autonomy, equitable and compassionate care, and reproductive and sexual health worldwide. So we do know that exposure to structural racism has been shown to be a leading risk factor for adverse maternal and infant health outcomes among Black women. So in this new study, and it was led by a researcher by the name of Brittany Chambers, researchers held focus groups with Black women to define structural racism and how it shows up in their life and in their communities. So for this study, the women defined structural racism as a system that distributed unequal access to resources and opportunity. So there were 9 domains of structural racism emerged from these women's stories. Here are the 9 domains. Negative societal views. Black women described constantly being labeled as dangerous when navigating in public spaces. Under housing, Black women describe experiencing structural racism through neighborhood segregation and inadequate housing through forceful evictions or overpricing of Black renters. Medical care. Black women reported encountering inadequate medical care, and Marissa, to your point, a direct result of a lack of culturally responsive providers and staff. One of the 9 domains was law enforcement. Black women described police harassment, highlighting a broken law enforcement system that endangers their health, well-being, and livelihood of Black women and bodies. The livelihood of Black women and bodies. Then they looked at hidden resources. Black women also expressed struggling and feeling alone due to a lack of resources tailored towards Black women and Black communities. They looked at employment. These are all stressors due to what we're talking about, due to this racial discrimination and all these other things that we're talking about. So they look at education. Black women describe a system that doesn't provide equal access to opportunities for Black children, adolescents, and adults, that as well as unfair disciplinary treatment. They looked at community infrastructure. Black women clearly describe 3 ways that community infrastructure upholds systemic racism: widespread food deserts, hazardous parks, and the desensitization of ongoing violence in communities of color. The last thing they looked at was policing Black families. Black women described being policed when using medical and supportive services from the government. So this study supports the need for screening for social and structural determinants of health, especially when providing care to Black women. It also suggests the need, as many of us in this room know, ongoing racial equity trainings for providers and diversifying the workforce. So, anything in the chat, Zami? And anything, always love to hear any feedback from our discussion or some of the things that I'm presenting.
In the chat, we have a link to unnaturalcauses.org. I don't know if Mauricio wants to share a little bit more about what that site is or not.
So when you're looking at all these structures, interpersonal, internalized, institutional, structural, and how this discussion around weathering impacts it, this survey really kind of really laid that out for you. These are voices of Black women and how structural racism is a person is a not internalized, but structural and institutional racism actually impacts their daily life. Anything else in chat, Zami?
So, so your mic is not currently working, Mauricio, no. But they
Okay.
shared that it's a resource that discusses many of the issues we're speaking about today.
Okay. All right. So only in Geronimus, one thing that she said was the other part of weathering is still not widely grasped. And that's the coping part. The part where the people being weathered stand up, the people being weathered have their voices heard, try to be resilient, although I don't like that word resilient, and try to withstand all the structural barriers and the exposure or the exhaustion. So that brings me to this and how it was kind of introduced in the video, this angry Black woman. So this angry Black woman character goes way back. So like looking at the roots of angry Black women, you see it in like chattel slavery, when expressions of Black female anger, particularly toward white slave owners, were profoundly justified, but also impermissible. So, and then when you think like in your mind, and I've heard this before, the image of angry Black women is ready-made, you know, one hand on her hip, one finger pointed in your face, you know, and it's so disrespectful, the head and neck swirling. Yes, she's intimidating, she's overly sensitive, she's mannish, which I've heard that word before as it relates to Black women. She's easy to piss off and difficult to calm down. She's aggressive and irrational, she's too loud, and she's just too much. So in recent years, unfortunately, our culture has stapled the belittling, angry Black women label to people like Michelle Obama, to like Serena Williams, to Shonda Rhimes, to Maxine Waters, and many others in response to their kind of truth-telling, their kind of creativity, and their demand for self-respect that we applaud in others. So each of these women have hard-won power and an authoritative voice, but we as a culture, unfortunately, don't want to hear what Black women have to say if they're saying a certain way. So I see some things in the chat.
Yes, Mariska put Black women are not afforded the label of soft and feminine.
Yes. So unfortunate and so not true. So this angry Black woman stereotype means that when we express anger or dissatisfaction, other people are primed to see us as irrational or unhinged. So it's so pervasive that even emotions that aren't anger, which is sternness, dissatisfaction, strength, and refusal, get inadequately labeled as anger And instead of hearing us and responding, society continues to say the problem is a lack of that hypersensitivity instead of structural inequities. So, but also kind of getting to like how this works into what we're talking about, there are quantifiable consequences to living in a culture that plasters this like demonizing stereotype to people who express normal human emotions. So instead of sharing your anger, you stifle it and it burrows inward and it hurts you. Mental health challenges such as depression, anxiety, and high stress are often results of stifled anger. So, in according to the Anxiety Depression Association of America, anxiety among Black women is more chronic and has more intense symptoms than those experienced, unfortunately, by their white counterparts. So, studies show that Black women are less likely to seek help for anxiety and depression, and what they do are at a higher risk for ineffective and damaging treatment. So there's also a physical component to this because allostatic lows Black women bear, including repressed anger, can lead to physical health issues that disproportionately impact Black women, such as high blood pressure, heart disease, diabetes-related death, and even breast cancer mortality rates. So none of which is good for anxiety and for depression. So just wanted to look at these two quotes by Audre Lorde. She's a poet. She's a feminist and equal rights activist. Women responding to racism means women responding to anger of exclusion, of unquestioned privilege, of racial distortions, of silence, ill use of stereotype and defensiveness, misname and betrayal, and co-option. This is also from Audre Lorde. Women responding to racism means women responding to, I speak out of direct and particular anger at the academic conference, and a white woman says, "Tell me how you feel, but don't say it too harshly, or I cannot hear you." But it's my manner that keeps her from hearing or the threat of a message that her life may change. So that's really something. Tell me how you feel, but don't say it too harshly, or I cannot hear you. So this is the whole thing that, happened to always stifle your tone and having to always kind of stop before you say things because you don't want people to see you as this angry, like kind of unstable person, is kind of stifling what you're really saying and kind of your true self. So that's unfortunate. And, to that point, that's why I want to bring this out to correlate that to weathering and to high allostatic loads. Hey, Zami.
Hey Lisa. So in the chat, Mariska put the policing of Black voices to make it palatable. And then Anshay also put so common in the workplace, and Sophia said yep and agreed. And I also want to add, I was thinking about that as well, about experiences in the workplace, how when I have addressed the issue with a colleague and have been calm about it, and they were like, "Oh, well, I didn't really realize you were upset about it because you didn't seem upset when we chatted." And I was like, "Well, no, because if I showed expression of my anger, then it would have been you wouldn't have received it." Then other times when I do express, no, I'm actually upset because what you did was racist or inappropriate, then it's you should have said it nicely. And one of the things that I share with folks who I've had that conversation with, where they're like, well, we have to be able to say something gentler so people can receive it. One of the things that I say is, how am I supposed to gently tell someone that their knee is on my neck and I can't breathe, right? There's not ways for us to gently say that, but folks don't want to carry the weight of their behavior, particularly racism, the way that we as Black folks have to carry it. So
Yeah. Yeah, thanks for sharing that, Zom. And that kind of made me think of, I know my niece she's like a EVP her at her agency, executive vice president, and she was so upset. She was crying because when she received her review, stellar work, but she got dinged, Tommy, for not smiling enough. That she doesn't smile enough. That why don't you smile more? You know, like, and she said that her not smiling, made co-workers uncomfortable because she didn't smile all the time. And she has such this like beautiful face, and she's just so, but because she didn't smile, that was a point of contention for her boss, that she needs to smile more. So I thought that was pretty crazy.
Thank you, Lisa. In the chat, we have, I was guilty of policing my own people and had to assess myself on changing the narrative of others' experiences, not my own lane. And I also want to share that I was dinged once when I first started my career by a supervisor. And they said it was because they felt like I didn't want to be their friend. So I was stellar for my work, but supervisor felt like I didn't want to be their friend, so they marked me down on a performance evaluation. So that's a very common
As
experience.
what, unfriendly? They just said you're unfriendly?
I guess they're like, I don't feel like you want to hang out with me. And I was like, well, I work for you.
Wow. All right. Well, thanks everyone. So we just want to wrap this up with some discussion questions. We hope we get some engagement here. So discussion questions. How does this affect the way you provide services to Black women? How does this affect the way you engage with your Black colleagues? And what are some intersectional approaches to providing equitable care for Black patients? We'd love to hear at least one of each, of kind of what you think about, these discussion questions. And please feel free to choose any of the three, but we just want to get some takeaway thoughts from the providers in the room. How does this affect the way you provide service to Black women? How does this affect the way you engage with your Black colleagues? And what are some intersectional approaches to providing equitable care for Black patients? What say you?
Hey, Lisa, I don't provide care to Black women, but I think one of the things that I've been trying to do in all of these categories is to step outside myself as another Black woman and just say, you know what, my experience is not their life. And how do I walk beside them and empower them as well as the organizations that I'm with? So I'll give you an example. I'm looking for a provider in Colorado, and I looked at the website and I see no melanated at all. So I actually called the provider and I was like, you came referred by someone else, but I almost didn't call you because of the lack of color I saw on your website. And she was actually grateful. So it became a teaching moment. So I think when you see things, anticipate how you're going to engage it and create the change that you want to see. It's not always about putting down an organization, but how can I help build you up to recognize what's lacking?
Wow, thank you for that. Yes, I love that. Thank you, Mariska. Love to hear from one or two more people on either one of these. What are some intersectional approaches to provide equitable care for Black patients? How does it affect the way you provide service to Black women? And not to put people on the spot, and this is sometimes, questions like this people need to sit with, and if you don't, have a ready-made answer or something that you can think of right now, we want you to take this with you. Hey, Ashe.
Sorry, trying to find the unmute button. So I think this is the importance of, I feel like for me, I'm thinking about the importance of community engagement and why it's so why it's so needed and valuable, and not just saying, "Hey, I went out and did this," but really getting to know those civic organizations, some of the grassroots organizations, really getting a neat understanding of what they do. And I think even like for health department funders, just thinking out loud, like maybe this opportunity, right? Think about who are those non-traditional partners, right? To be able to ensure like we are engaging folks in a more meaningful way. Thinking about how this can definitely leverage like more status neutral approaches, because now you're thinking about what are those barriers, what are those hurdles or experiences that many like Black women, Black folks are experiencing, and what like can we do together that we can't do apart to fully like address these needs and to ensure we provide like equitable access. And I think that's why we need the inclusion of those like various voices, because they have various insight and also influence that can support ways to fully engage folks into that continuum of care.
Yes, Ashe, thank you. That's so important. Yes, thank you so much. Okay, well, we are at the hour. And like I said, sometimes, doing a lot of this work and asking sometimes questions like this, and I do understand that people have to sit with things sometimes, to process what's been presented, and to kind of get your thoughts together. So definitely want you to take these questions with you, and think about this, as we provide services, to Black women. So I want to thank everyone for participating. Zami, thank you for the invitation. And Zami, I'm going to see if there's anything else in chat, or give you, Zami, I'd love to give you, Zami, the closing words here, because you always have something so insightful to say, Zami. Zami, love to give you the takeaway.
Okay. Well, thank you, Lisa. There's nothing in the chat right now, but one thing that I will say is the importance of addressing social determinants of health when developing programs. And so I say that because, racism is a social determinant of health. Poverty is a social determinant of health. And even how we discuss our syndemics, how we discuss data, we should be including social determinants of health in that at all times. And I say that because, right, even our language, when we talk about food deserts, really a lot of these food deserts are actually care apartheids. And not everyone likes to use that word, but they're all based off of racism. They're all based off of intentionally separating folks by race, and filtering out the resources based off of race as well. So although we're talking about Black women today, when we think about the Black community across the board, when we look at a lot of social determinants of health, Black and Latina communities and First Nations or Indigenous communities usually are almost neck and neck at who is receiving the short end of the stick, right? And so we really do need to pay attention to racism. We really do need to think about when we're developing programs to center folks who are most marginalized and not them be an afterthought. So if you're developing a program that you really want to reach folks of color, Black, Latina, etc., then like Dr. Hall said, like Dr. Anshe said, reaching out to the community, including the community, getting engagement from the community, and realizing that they are the stakeholders. Even though our funders, yes, they give us the money, but the real stakeholders are the community that we're trying to serve. And so they should have the loudest voice. Thank you, Lisa, for bringing us in the last 3 years and doing a fantastic presentation. The QR code on the screen is a QR code to our survey. Thank you, Sophia, for also dropping the survey in the chat. And if you all have questions for Lisa, we do have 9 more minutes. And so Lisa can hang out for a little bit, and feel free to put your question in the chat or unmute as well. So thank you. Thank you.
Thank you, everyone. Have a good day. Thank you, Zami.